Presidential Task Force on COVID-19, Honorable Ministers, members of the Presidential Task Force on COVID-19, Nigerians watching this program from home and from your offices, gentlemen of the press, a very good afternoon to you. Today is Thursday, 25th June, 2020, and I welcome you to the national briefing by the Presidential Task Force on COVID-19. This afternoon, we'll be taking the remarks of the chairman of the Presidential Task Force, the technical updates from the Minister of Health, the DG NCDC, and the National Coordinator. Before we go to the question session, we'll take updates from the Honorable Minister of State Education and the DG NCAA, who is standing in for the Minister of Aviation. So we begin this afternoon with the chairman of the Presidential Task Force, the Secretary to Government.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me start by apologizing yet again. Our meeting quite stretched as we are notching home to the end of the phase of the ease of the lockdown. We had to consider so many things. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 25th of June, 2020. You will all recall that on Monday, 1st June, 2020, we commenced the second phase of the eased lockdown in our national response to the battle against COVID-19 for a period of 4 weeks. As we informed you on Monday, we have entered the closing week of the second phase and approaching a decision point. We shall be carefully considering the fact of a growing pandemic and the risk perception in our efforts to balance between lives and livelihood. This pandemic is definitely not over, and we must remain careful and vigilant. All through the month, the Presidential Task Force communicated to Nigerians in different ways the dangers of complacency and non-compliance with measures prescribed for the fight against COVID-19. Particularly, Nigerians were reminded that there is presently no known vaccine for the virus, and that all over the world, non-pharmaceutical measures still remain the most effective, and avoiding being infected remains the best choice for everyone. The Presidential Task Force also continued to assess the developments nationwide and found that non-compliance has been largely fueled by skepticism and ignorance about the disease. We also noted that stigmatization has further impacted on the willingness of people to come out to seek help and even tell their stories. In most cases, by the time they take a decision to come out, it is rather late. The nature of this pandemic demands that we must detect and treat it in order to address it. Let me emphasize, therefore, that COVID-19 is not a condition to be ashamed of, as it has no respect for status, nationality, race, creed, tribe, or color. Every person infected must be treated to prevent spread and avoid fatalities. As we deepen the community engagement and risk communication phase of our national response, the Presidential Task Force still reiterates the need for ownership, taking responsibility, and expanding the scope of sensitization, all of which combine to make our ability to maximally detect, trace, isolate, and treat nationwide successful. You would have noticed that the number of confirmed cases and fatalities released in the last few days have been on the high side. While we attribute this to increased testing, it also goes to confirm the extent of the spread within our communities, especially the 21 local governments that are considered high burden, identified as accounting for over 60% of infections nationwide. Closely related to the high number of confirmed cases and fatalities at home are lessons drawn from other jurisdictions, from Europe to China to the United States of America. The rising numbers and reported resurgence in some cases should also be of concern to us. Of particular concern, however, is the case of Brazil, which has exceeded the 1 million mark of confirmed cases, with over 50,000 fatalities. We have informed you that Brazil shares several cultural, demographic, and climatic affinities with us. If any lesson is to be learned, Brazil should be a subject of interest that will make us change our behavior. In furtherance of the collaboration with subnational entities, the Presidential Task Force joined the Nigerian Governors Forum and the NEC in a virtual meeting yesterday to evaluate the progress made so far. The outcomes of the discussions will be factored into the decision under the next steps. Ladies and gentlemen, the Presidential Task Force notes and acknowledges progress being made globally and domestically to search for cure for COVID-19. It also notes with delight the recent announcement that 4,000 people have volunteered for a vaccine trial in the United Kingdom, which gives room for greater hope. We similarly look forward to the outcomes of validation processes for submissions made by some Nigerian CITES. Given the findings made during our assessment, I feel compelled to reiterate the non-pharmaceutical measures put in place by the Presidential Task Force so that you will have the opportunity to internalize all these measures. The first being wearing of face masks in public places, keeping social distancing, maintaining good respiratory hygiene, washing of hands regularly, avoiding large gatherings, generally changing our behavior and actions. And finally, taking personal responsibility for our lives and those of our loved ones. Please remember, all the measures listed and many more are meant to be observed in a combined manner in order to make them effective in saving lives. These are our fighting opportunities for survival. The Presidential Task Force has continued to receive reports about hospitals rejecting patients, thus resulting in needless death of patients suffering from other ailments. We continue to plead with these hospitals not to reject patients, but to follow the protocols for managing COVID-19 while receiving them, and most importantly, to seek necessary accreditation from the Ministry of Health and the Nigerian Center for Disease Control to manage COVID-19 cases. Finally, I wish to inform you that by the end of this week, the Presidential Task Force will be submitting a report containing our assessment and recommendations to Mr. President for his consideration. We therefore urge Nigerians to await our recommendations regarding the next steps of action to be taken in our national response to COVID-19. I now have the honor to invite to the podium the Honorable Minister of State Health, followed by the DG Nigeria Center for Disease Control and the National Coordinator to update you on new developments. And I thank you for listening.
The chairman of PTF, my colleagues and the committee, media representatives here present, distinguished ladies and gentlemen. The number of deaths related to COVID-19 cases in Nigeria has continued to rise. The import of this is that as individuals, we are more than ever before continually reminded to take personal responsibility for our health and be extra careful in our daily activities. As of yesterday, we had 649 new confirmed cases, bringing the total number of cases in the country to 22,020. We have so far successfully treated and discharged 7,613 persons, while sadly we have recorded 542 deaths. On Tuesday, 23rd June 2020, an emergency National Council on Health was held virtually. In attendance were State Commissioners of Health, Secretary of Health in the FCT, heads of agencies under the ministry, directors, and the Federal Ministry of Health, development partners, and other stakeholders in the health sector. Council reviewed the status and alignment of all response activities of COVID-19 outbreak in the states. The Council approved the National Health Sector COVID-19 Pandemic Response Action Plan, which was developed by the Federal Ministry of Health in collaboration with departments and agencies to present one response in the health sector delivered in a coordinated and strategic manner. As we learn more about the disease, we continue to evolve response actions. The community transmission has resulted in a high number of confirmed cases, with the challenge that in some states, the facilities for case management may become overwhelmed. Bearing in mind the importance of managing cases in facilities, the Federal Ministry of Health, through the National Primary Health Care Development Agency, has developed a guideline for the establishment of community support centers where desirable. A central objective of this guideline is the establishment of community support centers in selected clusters of local government areas for the management of COVID-19 cases. These community support centers will strengthen the capacity of the health system at the community level to respond to the outbreak with a view to reducing the transmission of COVID-19 within communities in high burden and high density states. We must daily be reminded of the challenges COVID-19 poses to Nigeria and the world. Hence, the need to reinforce our resolve to tackle the pandemic. We shall continue to strive to reduce case fatality in Nigeria. In this regard, we will seek cooperation from all to scale up our non-pharmaceutical interventions while we get more proactive in dealing with positive cases. We shall improve on our testing, tracing, treatment, and isolation, with priority on offering more protection to our elderly citizens and those with comorbidities from the threat of infection. I thank you for your kind attention.
The Federation and Chair of the Presidential Task Force, Honorable Ministers, gentlemen of the press. I'll be fairly brief today, really respond to a few issues that have been on the hot burner, 3 particular issues. Firstly, we do look out on what people are discussing on the media through different platforms. And over the past few weeks, there have been a lot of discussions over the role of a loss of smell and taste as symptoms of COVID-19. These have been recognized globally as symptoms of this disease. There are very few other diseases that would cause a sudden loss of taste or smell, especially in normally otherwise healthy individuals. So it's most likely that this is linked with an increasing incidence of COVID-19. So we would expect that this should also lead to increased presentation at clinical facilities and increased testing. So this is just to make it clear to Nigerians that if you do feel that you're losing your sense of smell or taste and taste, this has been recognized as a symptom of COVID-19. You should be presenting yourself and for testing. We will, all over the country, there are people there available to test you through the state's public health infrastructure and in order to rule in or out whether you have COVID-19. Secondly, there's been an increasing use of face shields to apparently protect you or the population from the transmission of COVID-19. And today, I'd also like to advise that face shields are great, but they should be used in addition to face masks and not in place of. I know we haven't been clear on this, so we are doing that now. So we will forgive anyone that is wearing it today on both sides of the aisle. But please, we are learning, and that's what I've always said on this particular disease. So we're learning every day, new technology is emerging, and the lack of evidence of effectiveness actually doesn't mean that we will not ultimately find evidence of effectiveness. But from what we know at the moment, it is not sufficient. It's not sufficient to protect ourselves and the population. So we can gradually, over the next few days, evolve out of face shields and back to masks. And so the third point I just want to touch on too are vulnerable populations. Many of us are either at the borderline of that classification of being 50 and above, and many of us have underlying medical conditions. So when you talk about comorbidities, it sounds like something very rare. Many of us are hypertensive. It's much more common in Africans than in others. Many of us are diabetic. We live with it every day. So these are not strange illnesses. And I just want to remind all of us, many members of our family have these diseases. So we have to be really, as we think about the risks that we take, it's not just about us. It's about those of our friends, our relatives that may have any of these, when we call them comorbidities, it sounds like a strange, impossible thing. But really, these are really common diseases that many of us, if you do a random sample of this room, you'll find that 10–20% will be hypertensive, 2 to 5% will be diabetic. This is just a fact of prevalence and distribution of diseases. So these are not rare diseases. So as we take these risks and try to be motivated to do the right thing, let's think about others that may be more vulnerable than ourselves to these circumstances. So it's important to think about age and people that have hypertension, diabetes, cancer, as really vulnerable to having a much more severe illness than the rest of us. So just on those 3 thoughts today, very simple thoughts, if we can reflect on them over the weekend, use them to change behavior as much as possible, and try and keep safe as we go into a very important weekend in making key decisions about the future. Thank you very much.
Honorable ministers, members of the PTF, gentlemen of the press, good evening. Today I'll be talking about disbelief. I will be tackling headlong the issue of why people feel that COVID-19 does not exist. We are aware that many Nigerians do not believe that COVID-19 is real. Many think that it is a scam or a ploy to access funds meant for public welfare. Some do not believe it's real simply because they have not seen or do not know someone who has tested positive for COVID-19. But tell me, how many of you have seen a case of Ebola? How many of you have seen even a case of Lassa, or even some of the more sort of common infections? You do not need to come across a patient with a life-threatening transmissible infection before you believe in it. There are people who do not believe it's real because they are not seeing the sort of high number of deaths or the health crisis that is currently occurring in many parts of the world. But our numbers are already increasing. We don't want to reach that stage. But if we don't want to reach that stage, we have to take those measures that are necessary to protect ourselves and our loved ones. A reasonable number of people still believe it's a disease that affects other countries but not Nigeria. Well, I'm afraid we are all humans in Nigeria. There's nothing special about us that provides us with resistance against COVID-19. None. As the chair said, our climate is very similar to that of Brazil. The health system is much, much more sophisticated than that of Nigeria, but you can see the sort of problems they are currently facing. We must start believing in COVID if we are to protect ourselves from this infection. The truth everyone must know is that COVID-19 is real. People are dying from COVID-19. We have had personal experiences of that. There are people that are currently not with us at the moment because of COVID-19. Many countries in the world are fighting this pandemic. Over 9 million people have tested positive, not suspicion, but tested positive for the disease. And at least 22,000 of them are in Nigeria. There are thousands more in our country. For every one case, there are a handful of cases that we are missing because we are not able to test everybody. Governments across the world and even in Nigeria have shut down their economies and lost valuable resources in an effort to control the spread of COVID-19. The containment measures that were put in place to protect the public are there to protect the public. They are not there to swindle them. No sane country on earth will destroy its own economy willingly. No sane country on earth will take major decisions that they know would be detrimental to their economy. Even among the strong economies, some of them have had significant drops in their GDP as a result of containment strategies. They would not take those steps lightly. No. And certainly in our generation, for our generation, this is the most important public health emergency of its kind. When was the last time people have been locked in their houses for 5 weeks? For 5 weeks. When was the last time we closed the civil service completely? We stopped flights from coming in. We haven't had international flights that are scheduled for a long time. So we're living in really challenging times, and we couldn't have taken these decisions just on the basis of maybe suspicion that a disease exists. This disease does exist, whether we like it or not. It exists. If we want to survive it, we have to start believing in it. The profile of infected people has shown us that COVID-19 knows no class, it knows no race or gender, and it can certainly affect anyone who is exposed to it. We do not need to know someone personally who has died from COVID-19 to believe it is real. In fact, I think it is a disservice and it is insensitive to those families that have lost loved ones for people to continue to claim that COVID-19 does not exist. The PTF is appealing to Nigerians to assist the government and all our partners at all levels to fight against this virus by taking ownership of this fight. And this is by following strictly all the health advisories we have provided, including always wearing a face mask properly, not on your chin, not to cover your beard, but to cover your face and your nose. Maintain physical distancing at all times. Avoid mass gatherings. Wash hands frequently with soap and water. Use hand sanitizer and disinfect surfaces. We may be relaxing some of the measures we put earlier on, but the relaxation does not mean that we are at a lower risk of catching this. As I keep on saying, now, today, you are at much, much higher risk of catching COVID if you go into a public space than you would ever have been in this country because of the numbers we have. And if you do not need to go out, stay at home. That is still the best advice we can give you. Let us not wait for the virus to reach disastrous proportions before we begin to believe and act. We are already seeing this happen in many other countries. We must learn from their experiences to mitigate preventable fatalities. We know that humankind has survived previous pandemics. We know that this challenge will pass. We also know that for us to be able to face this, we must not despair. We must face this challenge headlong together and survive it. Thank you.
Invite the Honorable Minister of State Education to the podium.
Good evening, everybody. I'm actually constrained to make this clarification because some of our brothers in the press did publish something yesterday to the effect that we are not no longer sure, and that somebody claimed that I had told him or them at a Senate briefing that the coronavirus is a sham. Well, I must address you all and tell you that no such thing transpired. Coronavirus is real, and we've been meeting over this and working to strengthen our response to this pandemic. I recognize, as somebody who is in the Ministry of Education, that all our intelligent quotients are not at the same level. So maybe some people may have a different perception of what I said, or maybe I spoke in a lot of grammar that wasn't assimilated properly. So I must then excuse them. However, to be clear, I did point out that part of the reason why we are keeping our children at home stems from the fact that you can't see this coronavirus with your physical eyes. So you may not know if a child is asymptomatically carrying this. And if he or she so does, and then goes back home and infects another person, there's no way for us to guarantee. And besides, that the ministry had prior to now conducted a perception survey around the country. And we know that 80% of the responses we got from around the country were assurances from parents that they are not willing to experiment with any of their own children. If there are people who are interested in using their children to experiment to check whether it can work or not, we can invite them to test. But I can assure you that all the measures that we've taken are guided by the gentlemen who are behind us here, whom the president have assembled to give a scientific background that is governed by data and science to the decisions we make. I am sure that some of the work we presented, having taken some advice from them, will be reported maybe next week, because now we have sufficient information to make some decisions. And those decisions will be, first of all, x-rayed by and presented by the PTF upwards. And when we're cleared with that, I can come back here maybe by Monday and say exactly what exactly we are planning. But until then, kindly abide by what has been told, said by this committee. People should stay at home, keep our children safe, for you and for me, because they are the future journalists. It doesn't matter what their question will be. Thank you.
The chair of the PTF, distinguished members, ladies and gentlemen, good evening. Since the last announcement last week, Thursday briefing, that Sunday 21st of June is no longer feasible for the opening of the airport, I would like to report that we've had significant progress in the readiness of the industry to restart. The gaps have been closed, but however, we still have a few gaps within the aviation ecosystem, and this will be closed hopefully in the next couple of days. I've said it, and I'll keep saying it, we must get it right the first time, both on the issues of technical safety and health safety of all stakeholders. And one of these things we're going to use to close some of the gaps is a dry run test of both Lagos and Abuja, and Abuja airports coming up this Saturday. After this dry runs, we'll have a look, observe, and see the gaps that might still be there, and we'll close them. After that, we will announce a date of restart shortly, sometime next week. Aviation is already a very complex system on its own, and by the time you throw in the COVID-19 pandemic, it already complicates a very, very complex system. We will not take any chance. We are almost there. When we close all the few remaining gaps in the aviation ecosystem, we'll start. Thank you very much.
Verification. we now switch over to the question session. Are we ready to present our questions? Okay.
My name is Mitaire Ikben. I report for the Nigerian Television Authority. A critical aspect of the fight against the coronavirus pandemic is the search for solutions, whether homegrown or foreign. And we have already been told by the task force that with respect to a vaccine, it might not come to fruition until maybe 2021, as the case may be. So a lot of Nigerians are interested in what happens before then. Is it possible that we can have a homegrown solution before 2021? Because the Presidential Task Force has told us that three local claims have been shortlisted for validation. That's, I believe, in addition to the Madagascar solution. So my question is, what is the timeline for this validation, and what is the process like and the timeline? Because Nigerians are interested, they are watching closely, and they are following, and they want to know. Thank you.
Good evening, all. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like to just follow up with the question from my colleague Mitaire, and I'm directing to the Minister of State for Health. It has to do with the supplement we received from Madagascar. The ministry told us that some agencies have collected the samples for further studies. How long will it take for us to get their findings, whether this supplement is useful or not? I just wanted to start from that because he asked a question about the timeline. Now, I would like to ask the DG NCDC regarding the records that we had in the last few weeks. I noticed that some states like Zamfara and Taraba, if we compare the number of confirmed cases from those states with what we had like 3 weeks ago, the cases are dropping. Is this any indication? Is it an indication that those states are winning the fight against COVID-19, or testing is simply going down in those states? What's exactly happening in those states? And I also like the Minister of Foreign Affairs to respond to this. Okay, it's not here. Oh, all right. I actually wanted him to respond to the criteria for enlisting people for evacuation, but it's not here. Maybe we'll keep it for another time. The Minister of Information, I would like you to respond to this. What's the update on the ventilators that was promised by the US President? You told us some time ago that the US President has promised to give Nigeria some ventilators. What is the update? Are we still expecting them? Are they giving them? Thank you.
Good evening, all. I'm Rachel Abuja from the News Agency of Nigeria. And my first question is to the Ministry of Health and, of course, the SGF. So when this whole pandemic came on board, Nigerians were not prepared. And the Basic Healthcare Provision Fund was giving us an opportunity to prepare for the next pandemic. I don't know why taking off the health emergency funding will not only do us wrong at this point in time, it will also put the country in a very difficult position. So I think it's something that the government should be looking at, and we should know what the government is proposing for health emergency. My next question is now for the Ministry of Health. Yesterday, Governor Darius Ishaku of Taraba State was pleading for testing centers. I would like to know who is responsible for setting up a testing center in the country. Now, my next question is to the DG NCDC. DG, I would like to know how much collaboration you have with the National Assembly to ensure that test centers are in each constituency at the moment. Meanwhile, how supportive is NCDC to see the enlistment of more private laboratories in the country for testing. Then my next question is for the coordinator. So actually this question is for the primary healthcare ES, but since he's not around, I would like you to help us out here. Now, there's 1.2 billion naira proposed for renovation of 7 centers in the 20 hotspots and areas of COVID-19. I would like to know where this money is coming from, if it's a grant, donation, or from federal government or state government, and we want to know the kind of renovation that we should be looking at. Many thanks.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orum from AIT. I would like to start with the Minister of Health. On Monday, I asked the Minister of Health when he was here the cost of treatment for COVID-19 patients. Well, he said it rests on state and FCT level. Well, I believe as the #1 man in the Ministry of Health, you should have an idea of what it costs to treat a COVID-19 patient that have spent at least 14 days in isolation center. So Nigerians will want to find out if you can attach a figure of how much it will cost to treat a COVID-19 patient. My second question is to the Minister of Education. Well, on Tuesday, you were at the National Assembly to present guidelines for possible reopening of schools across the country. Now, I'm aware that ASU has been on strike since the 28th of March due to IPPRS issues that have not been settled. Now, senior staff, SANU, and also non-academic staff union have also said any day the federal government rule out a date for possible reopening, that is when they are going to embark on 2 weeks strike. So I want to know exactly what your ministry is doing to ensure that upon resumption for our students to go back to school, they are not told to wait back and wait until issues of IPPRS are being resolved. My other question to you, sir, is that during your briefing at the National Assembly, you mentioned that one of the requirements for reopening of schools for some schools is they must set up an isolation center and also a clinic. For some schools that are in the rural areas, I want to know how they'll be able to get money to have an isolation center or a clinic, or is the ministry planning to give them some sort of grant or loan to set up these isolation centers? Thank you.
Good evening, sirs. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My first question is to the chairman, sir. Listening to you today and on Monday reeling out statistics, one can understand the strong warning that the worst is not over yet. And, but my questions I want to know, sir, in the course of making decision in easing out the lockdown, even though clearly you stated that easing out the lockdown does not mean downplaying the severity of this pandemic. So did you envisage the kind of situation we are today? The numbers are going up. Now, Dr. Sani Aliyu said, in each case that we have in Nigeria, that there are so many cases that are missing. So who knows how many people now are impacted with the disease? My next question is to the Minister of Health or NCDC DG. Sir, a recent study shows there is increase in vulnerability in the type of people that are infected with this disease. It shows even people under 40 are now vulnerable in catching and mortality rate. So I want to know, in the course of treating patients or study or research, did you notice any mutation in Nigeria? And my final question is to the representative of WHO. The vaccines, anything 2021, that's when we are expecting a vaccine. Looking at how ravaging is this disease, most especially the figures coming out in South America, it's scary. I want to know if there is any global collaboration in hastening the process of getting this vaccine. I may understand that these scientists are working with timelines. Is there any possibility of trimming these timelines so that at least we can have a percent. Thank you very much.
Good afternoon, sir. Honorable Ministers and my colleague. My name is Abiodun Oloyedepopola. I'm from Voice of Nigeria, Yoruba Service. So I'm supposed to have two questions, but I'm going to ask only one because one question has been answered by the Honorable Minister of Education, State. And I would like the Minister of Health, State, to please answer in English and Yoruba. I would really appreciate, sir. Sir, every one of us, we have in this phone. Some have iPhone, some have Samsung, some have different type of phones. But on this phone, there is one application by Google on how to detect somebody that has COVID-19. They call it COVID-19 exposure notifications. Somebody told me this yesterday, and I tried it and I found that it is true. I want to know how far our own government is going. I was happy when the DG was mentioning going into new technology, at least to overcome this COVID-19 in Nigeria. So I think I want us to look into that also. It's there on Google. When you go to your setting, you go to your Google, and you find it there. It is called COVID-19 exposure notifications. It is more than notifications. Yes, sir. So, and in Yoruba, sir, ìtumọ̀ ohun tí mo béèrè ni wípé àkọ́kọ́ ìbéèrè méjì ni mo kọ́kọ́ fẹ́ béèrè. Àmọ́ mínísítà fún ètò ẹ̀kọ́ ti abẹ́lé wọ́n ti dáhùn ìbéèrè àkọ́kọ́ torí pé ìròyìn káàkiri pé wọ́n sọ pé kò sí nǹkan tó ń jẹ́ àrùn COVID-19. Àmọ́ wọ́n ti ṣe kó yé ogba ará ìlú wípé ohun tá à ń pè ní àrùn COVID-19 wà. Èkejì tí mo tún wá fẹ́ kẹ́ bá mi dá lóhùn ní èdè Yorùbá ni wípé nínú ẹ̀rọ alágbèéká tí gbogbo wa ń gbé káàkiri yìí, ẹlòmíì ní iPhone, ẹlòmíì ní Samsung, ẹlòmíì Android phone tó ń gbé káàkiri kó mọ̀ pé ohun ẹ̀rọ kan wà ń bẹ̀ èyí tó èèyàn lè lò láti mọ̀ bóyá ẹni tó wà lẹ́gbẹ̀ẹ́ tó jókòó tiẹ̀ ó ní àrùn COVID-19. Wọ́n fẹ́ mọ̀ bóyá ìjọba orílẹ̀-èdè Nàìjíríà tí ẹ̀ ń sapá láti jẹ́ kí àwọn ọmọ orílẹ̀-èdè Nàìjíríà mọ̀ wípé ohun èlò yìí jẹ́ nǹkan tí wọ́n lè lò. Wọ́n á ní láti lọ sí orí setting fóònù wọn, wọ́n á lọ sórí Google, wọ́n á rí níbẹ̀, wọ́n ń pè ní COVID-19 exposure notifications. Thank you very much, sir.
The Chairman, members of the task force, my colleagues, my name is Amaka Ode. I report for Arise News. And my first question actually goes to the National Coordinator. So as we look forward to the next phase of the easing of the lockdown as it concerns COVID-19, are we considering criminalizing large gatherings? I ask this because aside from the concert that we saw those videos online that was just blatant disregard for the protocols, we're seeing political gatherings happening where we're seeing a lot of people cramped up in one place, some of them not even wearing a face mask, there's no social distancing, yet the numbers are rising every day. So are we considering that? Because it's no longer a time for us to keep begging and appealing to common sense. Right now, we need more than that in the country. And my next question actually goes to the DG of the NCDC. Where are we in terms of accrediting more private labs to ramp up our testing? I ask this because there were some reports that came out of Lagos that said some private hospitals, you know, we have said every patient who comes to your hospital, consider that they might have COVID, especially if they have some of those samples. They say when they send the samples to the accredited labs, it takes them up to a week or even 2 weeks before the test results are returned. And sometimes we know the kind of panic, and if those people, God forbid, they have this virus, they might eventually spread it before those test results come back. And also to the WHO representative, well, there's this study, I'm sure you must have seen it a couple of days ago, that actually spoke about the blood groups, especially those with the A blood groups, being more susceptible to having COVID-19. Would like to get, you know, your take on that. Really, and back to the DG of the NCDC, just to add to what Friday had asked earlier, as it concerns Taraba State and some other states, Kano State as well, we're seeing really low numbers, and there was a report I saw, I think it was on the NTA, that said, despite the fact that they have these test facilities, they might not have enough reagents to test. That's why we're not seeing enough numbers. So I'd like to get your reaction to that. Thank you.
Good evening, the SGF, honorable ministers, my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first set of questions is for the National Coordinator. I want to talk about the bed spaces. Earlier, there has been clamor for bed spaces. With the increase of numbers now, is there anything we are doing about it? Are we also asking the state government to increase the bed spaces, or how are they managing the cases now that the number has increased? My second question is still for the National Coordinator. Earlier, when the guidelines or medical advisories were given, we were told that we should avoid touching men. That's the mouth, the eyes, and the nose. That they are the windows for... they are the windows through which someone could contract this virus. But as it is, most of the attention is now given on the mouth and the nose. What about the secretion from the eyes, like the tears and the mucus? Are they not infectious? I want clarification on that. And then the third one, still for the National Coordinator. What guidelines do you have for pregnant women, like working class pregnant women that should be at work? Are they supposed to be at home? Do they stand higher risk of contracting COVID-19? And finally, for the Minister of State for Education, you gave some protocols for primary 6 pupils, JS3 and SS3. Is there anything you're planning or anything in place for final years university students or polytechnic students? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Baloyen. I write for the Sun newspapers. The coordinators, this is for you. I know the PTF has repeatedly appealed to Nigerians to avoid stigmatizing those that have recovered from COVID-19. But this is a story of a journalist who was discharged from treatment center last week, and she has faced stigmatization by her neighbors. I mean, the NUJ FCT chairman had to intervene at some point and take it to Human Rights Commission. So my question is, what are the remedial measures the PTF will take regarding stigmatization that will make people who test positive not to, to help in combating the spread? Thank you.
Good evening, Mr. Chairman, members of the task force, my colleagues. My name is Mohammed Salih Nazif. I work for Voice of Nigeria. My question goes to SGF, WHO, and Minister of Information. Let me start with SGF. Sir, I have observed you personally and all the members of the task force. All alone, what I see is nothing but dedication, professionalism, quality leadership, sportsmanship, and total loyalty to this country. May God continue to help you. Sir, considering the amount of investment in terms of money, materials, and personal effort put in the fight against COVID-19, on the other hand, we still see increase in cases due to lack of adherence to simple guidelines, coupled with level of fake news in the social media, some other print media as well, as to whether COVID-19 is real or is not. How do you really feel personally in all this that is happening? How do you really feel personally, considering the amount of effort you people are putting, and at the same time, some people somewhere are every day coming up with different kind of this thing? I want to know how you people feel about it. And secondly, your task force has a timeline, which is 6 months. Do you see us flattening the curve before the end of your term? My question to WHO, Madam, women and children make up about 80% of internally displaced population in armed conflict zone, who are in their need of medical intervention, but face with challenges in accessing health care. In order to assuage this problem, WHO came up with effective intervention strategy in Mediterranean countries, particularly Syria and Iraq, which came out completely effective. My question is, looking at what is happening in Africa, and especially Northeast, where we have internally displaced persons and some areas of conflict zones, are you applying the same strategy in those areas? And what is the impact of WHO so far in those areas? To Minister of Information, not quite long, Education Minister came out and debunked some of the fake news that are on a media space, especially, social media. But my worry is that if it is only social media, one can say, yes, social media is not a governed space. But we see traditional media organization, especially newspaper in Nigeria, always carrying fake news. Always carrying fake news. Even not quite long, and concerning the ex-governor of Oyo State, some they will say he died, the next day they will say, he's getting better. The same newspapers are still carrying. What is your ministry doing? Are you really engaging these people? If it is a social media, it's fine. We know it's an ungoverned space. But then, journalism has responsibilities, has ethics, has guidelines. Why are they always coming up with these kind of things? At least simple call they can put across. Either the man died, or either this thing is real, either the Minister of Education have said what he has said. But no, the next thing you see, bold headlines, fake news. What are you doing about it, sir? Thank you.
That final intervention closes the question session. We'll be taking our responses from the Honorable Minister of State for Health, the DG NCDC, the National Coordinator, the representative of the WHO in that order. After that group, we'll be taking the Honorable Minister of State Education, the Honorable Minister Information and Culture. The question for the Honorable Minister of Foreign Affairs, we'll put it in the basket until he's available at the next briefing to answer. The chairman of the PTF will round it up. As usual, let's begin with the Minister of Health. Honorable Minister.
Starting from Itairi, he was asking about the possibility of homegrown solution, particularly having had the Madagascar experience. I think Friday just built on that. Now, that in the absence of vaccine, which we are told may not be ready until 2021, that is there any effort? Yes, there is an effort from Nigeria, particularly through the Ministry of Health, and looking at our traditional, or what we call TCAM, that's traditional, complementary, and alternative medicine. You recall that we did say at this forum some time ago that we had a virtual conference with our traditional and herbal practitioners. And it was a robust engagement where all those who had remedies were asked to come forward to present such remedies. And 19 of them participated and came up with their remedies, which we had since passed on to NAFDAC. Now, in assessing the efficacy or otherwise of a remedy, the first port of call is NAFDAC. And now, what NAFDAC does essentially is to determine the safety. That is that product fit for consumption? That is the fundamental thing. That's the first thing that you want to establish. And that's just the first step. Because when that is done, the remedy is listed. It will then pass through some other levels. For example, it will have to go to NIPRID. That's the National Institute of Pharmaceutical Research and Development. And while this is going on, of course, you also get the Nigerian Institute of Medical Research involved. Then you move on to the clinical trial. Because the fact that a remedy is fit for consumption does not say that that remedy has efficacy. They are two different things. Fit for consumption. In fact, earlier today, I gave an example. If somebody comes up with a bottle of water and make claims with that bottle of water, NAFDAC will only first determine that this water is fit for consumption. It will not harm you if you drink it. But it does not mean that that water will cure your ailment. It is when it's established that it can cure your ailment that you now talk of efficacy. That's the fundamental thing. But having said that, it's a process. Because it's a new remedy that is unknown in terms of what it's capable of doing. You now need to go through clinical trial, which has different phases. And because it's something new, you will need to establish through volunteers. In fact, the ideal thing, you do animal studies. If an animal dies, yes, it may be painful, but not when a human being dies. So that is why oftentimes you want to do the clinical trials in animal studies. And then you can graduate it if you feel reasonably comfortable. And in so doing, you get the volunteers, which is a whole long process because you need to explain what you are doing to these volunteers. That's why you cannot just take this remedy and start applying it on patients. No, it's not done like that way. There is an international protocol for all these things. So you need to explain to the patient that this is a new product, a new remedy, a claimed remedy, which you want to apply, and that if you are willing to be part of it, please signify. And they will be made to sign so that, God forbid, if something happens, both sides will be covered. When you try that, and of course, it's not just a matter of trying it on 1, 2, you have to try it on a large number of people, volunteers. Then you move from there. If you're able to establish some efficacy, maybe in terms of reduction of symptoms or time spent in hospital, you will establish all that. And the nature of this, if a patient came in with fever and that remedy is able to lower the fever, then of course you mark that that's something. If the patient is having headache and you're able to abort that, you note it and all that. But this does not mean that at that point you start applying it. No. You will still have to measure whether there are side effects, which you need to measure over time. You need to establish that. Because yes, a drug may be efficacious, but with very deleterious side effects. Now, as a clinician, you will not say because the drug has side effects that you're not going to apply the drugs. If what we call therapeutic advantages outweigh the side effects. So these are processes. So the long and short of it is that there is no shortcut to these processes. No shortcut. It's a long process which you must establish. And of course, there is also what we call the statistical significance. Whatever you are getting, is it significant? Is it such that can be projected into the larger population? These are various things that you want to. I know that in medical history, those of you probably would have heard of the drug thalidomide. Thalidomide was a wonder drug in those days, which was being used as a sleeping drug, will calm people. But along the line, they discovered that when they were giving birth to malformed babies, they discovered that it was thalidomide. Well, so that's just it. It takes a long, there's no shortcut to it, please. Then, of course, Friday, what just built on what Itari, the question, and he now referred to the COVID organics, that is, this liquid remedy, quote unquote, sent from Madagascar, and also was asking what the timeline. I cannot give you a timeline because of all these processes. And of course, Mr. President insisted, and that's the right thing to do, that this must go through our own procedures and processes before. So the last that I had, which was just this morning from NAFDA, is that NAFDA has done its own bit, and the report will be forwarded to the Ministry of Health, maybe by tomorrow. But they have done their own bit, so they're going to pass it on to other levels and other agencies that will take over from that. So that's that for Friday. Well, Rachel, I think you mentioned the issue of basic health care provision fund, and yes, we're trying to address that issue. You will recall that we had some issues about that with the National Assembly in terms of the application, and we needed to ensure that we keep within the ambit of the law. You know, the Basic Health Care Provision Fund as provided in the National Health Act. And as rightly said, it's one of the things that will help us in various things we are trying to do in terms of putting in place national emergency services and all that. And of course, it's also something that will help us even in management of a pandemic like this. So it's one of the provisions of the law that will help us to do better. You were asking the question, I think that will probably be answered by NCDC. The question is, who is responsible for setting up testing center? All I will say is that the role of PTF and the federal is to support, I repeat, support the states. So our collaboration with the states is with a view to supporting them in what they do. So if they have, that's why you see some of the states that already have, they even have PCR testing laboratories. Or some of them, they have gene expert machines and all that. So what the NCDC does is to go there and assist or support them to put these things in place by way of ensuring that the protocol, all the necessary protocol with respect to infection prevention and control, the proper personnel, the issues of biosafety and biosecurity, that all these issues are in place. That's what the NCDC does. Of course, under the Ministry of Health. But we don't go and put it there. And of course, if you have the private sector that might just come in to assist in this regard. But our role at the center, that is both at the ministry level, Federal Minister of Health, and the PTF, is to support and collaborate with the states. Well, Nancy, again, your question, you want to know how much does it cost to manage a COVID-19 patient. It's difficult for various reasons. One, COVID-19 cases are not being managed in the same center. Some of them are being managed at the level of the teaching hospitals. Some are being managed at the level of federal medical centers. Some of them are being managed even at the level of general hospitals in the states. And these centers, if they were to charge fees, they are not the same. Just as we have patients, COVID-19 can be managed in some centers, private hospitals that have been so designated and properly assigned to do that. So it will not be the same. And even for any other patient, one, the environment is like if you go to a 5-star or 7-star hotel, or you go to a 3-star hotel, you will not pay the same fees. Because the fees that will be charged usually, you will talk of bed fees per day. You have services ranging from nursing fees. You have feeding. You will have laboratory services from the basic full blood count, what have you, chest X-ray. Particularly with COVID case that comes in with cough, one of the basic things that you want to do is chest X-ray. Not to talk of scan, what have you. You have so many other things that you want to do. So that's why it will be difficult. And some of these tests are not tests that you just do once. They will be serialized. You may have to check the full blood count every other day, depending on what you are seeing. You may have to repeat your chest X-ray if there are changes going on in the chest that you want to follow up, or do a scan. And again, where the patient has comorbidity. The patient is coming in, diagnosed as COVID-19, but that patient has a cardiac condition, a heart condition. It may even be heart failure. It may be renal issue. It may be some other things. So, and all this have to be monitored as well. So that's why it is extremely difficult to tell you what it will cost to manage a COVID-19 patient. It depends on where the patient is being managed, what the investigations and what personnel. How do you cost the services of consultants? Because you may have what you call multidisciplinary approach, where so many consultants with different specialties are coming to examine a patient and offer opinions, depending on what. Or you have a patient on ventilator. How do you start to, even if the patient is on a ventilator, but you just need oxygen concentrator to deliver oxygen to that patient. How do you cost all that? So it's a very difficult thing to say. Abiodun, Voice of Nigeria. Well, you are talking about an app that can give you your COVID-19 exposure notification. It's just a risk thing. The first thing to say is that this present administration, under President Muhammadu Buhari, you will recall that the administration renamed Ministry of Communication as Communication and Digital Economy. We are in the digital age, and the implication of that is that the entire world is going digital. There are so many things that you now do online or through digital intervention. So that app is an app that, based on certain information supplied, it can reasonably give you what's your risk. I remember that the national coordinator, Dr. Aliyu, once told me that he's always checking his risk exposure, and that at times it's so high. Well, it's high for every one of us on this side because of the places we go in course of duty and all that. But having said that, it is important to say that if the app even exists, if you don't download it, you cannot make use of it. So in essence, I'm saying that you must know what is there on your handset. And studies have shown that the average person, it doesn't matter how sophisticated, don't forget these phones are called smartphones because of what they can do. The smartphone can do virtually anything. It depends on how savvy the owner is in terms of technology and all that. But it has been established that not up to 30% of the functions on any smartphone that people usually use. So, because you can't give what you don't have if you don't even know what to do to start with. So it's a matter of education, it's a matter of exposure. Then, also the issue of buy me credit. It's going to burn your credit and data. So it also has a cost attached to it for the user. So that is also there. But it's a good one because it helps you to know what your risk exposure is based on information that is available. So in essence, I'm saying that good as it is, I think the owners of that app, they must have fed the right information on it before you can really download and make it useful to you. But I hope the national coordinator would like to speak more on that. I do know that Abiodun will also want me to say this in Yoruba. I will try. Nǹkan tí mo sọ ní èdè Gẹ̀ẹ́sì ni pé ẹ̀rọ ayélujára tí a máa ń gbé dání tí a ń pè ní fóònù, oríṣiríṣi nǹkan la lè fi ṣe. Ó ṣeé ṣe kí jẹ́ pé tí a bá mọ̀ ọ́ lò dáadáa, tí a dẹ̀ ní ìṣòro nípa wípé a ní credit àbí a ní data, tá a bá ti ra data yẹn sí orí ẹ̀ tí a lè fi máa, ó ní àwọn nǹkan tí ó ní bí a ṣe máa lò ó tí a fi máa mọ̀ wípé ó dàbí pé a ní láti máa ṣọ́ra nípa wípé ká má bàa ní àrùn COVID-19. ṣùgbọ́n ẹni tó bá mọ̀ ọ́ lò náà ló máa lò. Ẹni tí ò bá yé dáadáa àbí tí ò ní owó láti fi ra data tó máa fi mọ yí pé kinní yẹn ń ṣiṣẹ́, kò ní mọ bóun ṣe máa lò, á kàn máa gbé káàkiri náà ni, kò ní wúlò fún. Ṣùgbọ́n nǹkan tí ó dáa ni fún èèyàn láti ní lọ́wọ́, torí pé a lè máa jẹ́ ká kóra wa ní ìjánu wípé àti fẹ́ máa ní ó ti léwu níbi tá a dé báyìí o, a máa jẹ́ ká mọ̀. Mo rò pé nǹkan tí ẹ̀rọ ayélujára tí a máa ń gbé káàkiri tá à ń gbé dání tá à ń pè ní fóònù yẹn, nǹkan tí ó wà fún nìyẹn. Well, I hope I have tried to explain in a way that I could. I think that's it. I think that's all for me. To cater for funding. Oh, okay. Well, we have our budget in the Federal Ministry of Health, and depending on what we present before the National Assembly, and of course, depending on how much is made available to us, we'll have to manage it within the ambit of all the services that we render in the Federal Ministry of Health. But definitely, we have some funding in the budget, the national budget. And of course, when we have issues like this, which is a public health issue, of course, you know that we've been having some support from so many organizations, WHO, EU, European Union, United Nations, what have you. All this, and of course, you have private agencies, you have our development partners, and you have our international NGOs, and even the local ones, like the Dangote Foundation, Emeka Ofo, so many of them. They choose a lot of public health issues which they support in their own way. And I see this opportunity to thank all of them. Thank you very much.
So, thank you. A few short questions. In Zamfara and Taraba. You know, the reason we put out the numbers for gentlemen of the press every week is so that you can use these numbers and interrogate the owners of the producers, the people responsible for collecting samples and making sure that people are tested. So that's really the main reason we put them out. Yes, we haven't received as many samples as we have received in the past, especially from Zamfara. We're engaging with the state government. We keep pushing as best we can across the country. They've done very well in the past. Lately, we have seen a slowdown, same as in Taraba. So we will keep pushing. But you know, it's not just for NCDC to do. These are for state governments to ask questions, gentlemen of the media to ask questions, citizens to ask questions. That's why we put out the media. Every night we put out the numbers. Every night we work very hard to give Nigerians the numbers, to give health professionals the numbers, for you to understand, for healthcare professionals to understand, to hold us accountable, but not just NCDC accountable, to hold their state governments accountable, to hold their leadership across the spectrum accountable. So if people are not testing because of whatever reason they're not testing, the numbers are out there. We're a society, we're a big country, we need to do the right thing, and we need to ensure that we're all held accountable, not just one agency. We have provided the testing infrastructure, we've provided the reagents. By the end of next week, once we roll out the Gene Expert, completely. 3 states have started. The 7 states, by the end of tomorrow, will have gene experts in 7 states. By the end of next week, every single state in Nigeria that wants to will be able to test within the boundaries of its own state. So access to testing is no longer our biggest challenge. Our biggest challenge now is to collect the samples. It's the only entry point into care and public health management. So together with our partners, the federal government, the UN, we have thrown resources into this testing problem, and we've done the best we can. Now it is up to us, collectively as a country, to use the testing to test people, get them into care, and to prevent further transmission. Testing on its own is not the final solution, but it's the entry point, both into clinical care and public health management. Actually, Kano has tested the most number of people last week. So there was a question about Kano. We just came out of a meeting where we carefully looked at the testing numbers state by state in the meeting of the Presidential Task Force. And the numbers show that Kano actually has the highest number of people tested in any state in Nigeria last week. Yes, there were historical challenges, but last week, Kano tested the highest number of people in any state in the country. So some states are really turning around their testing capabilities. There was a question on whether we're working with the National Assembly. We always work with the National Assembly, but we have to remember the separation of responsibilities in a federal government like ours. The National Assembly is there to hold us accountable for the things we're supposed to do, and we will keep doing what we're trying to do. So our goal is not to have a testing center in every constituency. Our goal is for every Nigerian to have access to testing when they need that. And that's what we're doing. In some states, we'll have one. In some states, we'll have more testing centers in that state. The private sector is playing a big part already. There's a process of initiation into the testing infrastructure. I think the most progress has been made in Lagos because it's not a straightforward process. Many private sector labs have indicated interest, but when they've seen how complicated the process is to do so safely, they had to go through a process. So Lagos is probably the most advanced in terms of admitting private sector labs into their testing infrastructure. Remember, NCDC doesn't accredit labs. That's not our role. Our role is just to make sure they have the reagents and they can do so safely. But in terms of accreditation of the physical infrastructure, that's the role of the Medical and Laboratory Science Council of Nigeria and the state governments. There was a question about vulnerability and age, on the age of 40. You see, risk increases over the older you get. There's no line that divides 39.5 versus 40. As you increase in age, your vulnerability to severe outcome increases. And yes, there have been different strains found in Nigeria. We've been working with the Redeemers University in Ede. They have the most advanced capability for sequencing together with NIMA in Lagos. There have been different strains found in Nigeria, but there hasn't been any difference in clinical outcome depending on the different strain. So far, yes, there are different strains, but we haven't seen that if you have this strain, you're better off or worse off than the other strain. So that we'll keep looking at moving forward. I think the Honorable Minister of State has answered the question on timelines to vaccine development. If we have a vaccine in 2021, it will be the fastest time to the development of a vaccine ever. The normal timelines to vaccine development are 5 to 7 to 10 years. So to have a vaccine in 1.5 years is absolutely phenomenal. And those are optimistic timelines. So don't think that this is taking a lot of time. It's actually extremely quick to do the development, the testing in animals, testing in humans, testing for safety, then building production capacity for a vaccine that you want to distribute to 6 billion people in the world. So I think that's all the questions answered. Thank you.
The Executive Secretary, Primary Healthcare. I think I'll leave him to answer that. I'll not be able to answer it. But having said that, I can say that within our budget, we do have a budget for the establishment of isolation and treatment centers across the country, with a plan to set up at least one treatment isolation facility of between 40 to 45 beds in every federal medical center or federal teaching hospital in every state. In terms of the issue of criminalizing large gatherings, yes, there have been clear breaches in our guidelines. Moving on to the next phase, one of our plans is to enforce the guidelines that we have put, especially the issue of use of face masks. Yesterday, at a meeting with some of the governors, we urged them to put in place local laws and edicts that would allow authorities to fine people who repeatedly violate these guidelines. Already, some states have already got these laws in place, and we are strongly urging state governments to do so. We all know that people who do not follow these guidelines are putting us at risk, all of us at risk. And I would urge us to challenge those who are not wearing masks in public spaces, or who are not observing the physical distancing required, or have respiratory symptoms and are still exposing themselves to others. We've got to challenge them, because this is the only way that we can protect ourselves. In terms of bed spaces, yes, so bed spaces, we have had challenges across a lot of states. We still do have states that have less than 300 beds, which is the standard that we requested. But there are also states that have, that due to the high numbers, like Lagos, for instance, there's no way they can cater for every positive case of COVID infection. It's impossible. Overall, nationally, we know that our bed capacity is about 53%. So it's really variable. Some states still have extra capacity and some don't. And we continue to work with the state governments to make sure that isolation beds for isolation are available. Home isolation is really a last resort. We are also working with some of our partners to introduce the concept of community isolation or community support centers as part of our hotspot strategy for interventions that are more precision-based. Issue of avoiding touching the eye, mouth, and nose, and whether tears can transmit COVID infection. So this still remains a fairly controversial area in science, but what we know from a more recent prospective study, where they looked at 64 samples from 17 patients that had confirmed COVID, and they took tears from the patients at week 1, week 2, and 3. And they did not only viral PCR, but also viral culture. They were able to demonstrate that there was no viable virus, and the PCRs were all negative in those with confirmed COVID infection in their respiratory tract. So it's very unlikely tears will transmit COVID infection, but of course, there's nothing like absolutely impossible in science. Pregnant women guidelines, yes, there is a guideline already on the NCDC website, which I will urge all of you to read. But all available evidence at the moment suggests that pregnant women are at no greater risk of having more severe illness than a healthy adult when they develop a COVID. The large majority will exhibit mild or moderate symptoms. In one UK series, 1 in 10 pregnant women required intensive care, so slightly more than the usual 5-6% that we see. But what was very obvious is that the majority of those who became severely ill were in their 3rd trimester, which is why we advise pregnant women that are in their 3rd trimester, that's above 28 weeks, to avoid mass gatherings and to make sure that they comply with our guidelines. Issue of stigma was the other thing that was raised. Yes, we continue to work with our risk communication side to try and address the issue of stigma, what is important for people to realize is once you have COVID and you've recovered from it, you are no risk to anybody. In fact, once you have COVID and you recover from it, it's extremely unlikely that you will catch COVID again. So there's no need for stigma and discrimination when it comes to people who have COVID infection. As far as I know, I'm not aware of anybody who has gone out and said, right, today I'm going to go out and catch COVID. So it's not a case of blame. We have very little control over what we are inhaling other than using the normal prevention measures that we advise. And we'll continue to work with our partners to push through the message when it relates to stigma, not only for COVID, but also for other illnesses such as HIV, etc. Thank you.
The Chair of the Task Force, Honorable Ministers, members of the Task Force, ladies and gentlemen of the press. The question posed was on the global collaboration to hasten the development of a vaccine against COVID. Just to mention that it usually takes several years to develop a vaccine, and even with an accelerated process, developing a vaccine for COVID-19 will take time. WHO is working with many partners across the world to accelerate research and development of a safe and effective vaccine, and also to ensure there is equitable access for the billions of people that will need it. Together with global health actors and partners, WHO launched the Access to COVID-19 tools, which we refer to as the SCT Accelerator. It's a global collaboration to accelerate the development, production, and equitable access to new COVID-19 diagnostics, therapeutics, and vaccines. There are currently over 220 vaccine candidates under development at different stages. We have 2 vaccines that are in the latest phase of testing, and we expect to see results by the end of this year, although we cannot predict that at this stage whether these 2 vaccines will meet the required or necessary standards. Just also to update, there is a large-scale coronavirus vaccine trial that began in South Africa yesterday, making it the first African nation to be included in such a trial. The trial is being conducted in South Africa, in Britain, and in Brazil. And we will wait to see the outcomes of this trial. So there's a lot of global effort to accelerate vaccine development, but till then, we have to ensure that the non-pharmaceutical interventions continue to be implemented because they play a major role in breaking the chain of transmission. There was a question about blood groups and the association with transmission of COVID or protection or susceptibility to COVID. Yes, we are aware of the published data from the New England Journal of Medicine that highlighted an association between blood groups and COVID-19. WHO is encouraging a lot of research, a lot of documentation of information. It is a new virus, we need to learn more. And what happens when we receive such information, WHO, along with a large group of scientists and working groups that we coordinate, looks carefully at these findings, looks at other research studies, and pulls this information together to deduce conclusions. So we still have to review this information in line with those processes. For now, our message is everyone remains susceptible to this novel virus. We shouldn't feel safe or more exposed based on our blood group. There's a question about the vulnerabilities in IDP settings. People affected by humanitarian crises, particularly those displaced or those living in camps and camp-like settings, are often faced with specific challenges and vulnerabilities that must be taken into consideration when planning our readiness and response operations for the COVID-19 outbreak. These people may face challenges in accessing health services that are otherwise available to the general population. So based on these vulnerabilities, WHO has issued generic guidelines on outbreak readiness and response in camps and camp-like settings. We advocate with countries to pay special attention to vulnerable groups, including those in IDP settings. And we are working on the ground in the Northeast on closely supporting the state governments to ensure that there are appropriate preventive measures in IDP camps and that the appropriate risk communication contextualized to these specific vulnerable settings are provided. We have so far been spared of large outbreaks in IDP settings, but the risks are very high given we have community transmission going on, and so we must remain vigilant, ensuring that these special groups are given the necessary attention. Thank you.
The first had to do with what preparations we are making in case ASOP, and this will be in the lecturers at the polytechnics, that in case they strike when schools reopen. We're continuing our engagement with all lecturers in the education sector. We have asked that they please continue to engage with us. If the president has directed that they be paid all their emoluments, and we've gone ahead to pay them all their emoluments. We've asked that between ASU and other associations, anybody that has a shortfall, because of the peculiarities of their institutions, they should please engage the Office of the Accountant General of the Federation. They're being sorted out, and we don't think there will be any basis for any strike at all when schools resume. I think we've stayed at home enough. The second question relates to what you said or what you perceived I said at the Senate. We did not say at the Senate that isolation centers would be built in every school. We did not issue such a protocol. We are working on a protocol that includes the 6 thematic materials, what is number 1, temperature checks when you come to school, wash your hands, the safe distancing, wear a mask, almost all adults must wear a mask, except if you're a child that is below 5 years old, and continuous sanitation and hygiene in all the schools. What we have done at the moment is to ask that the PTF, using the standpoint of the Ministry of Environment, helps us to decontaminate our schools. Like I told you, there are nearly 200,000 school infrastructure around Nigeria. 68,000 of these are primary schools owned by the federal government. 38,000 are owned by private individuals. Then you add universities, polytechnics, colleges of everything, fishery, every kind of thing we own. And all of these are available in the country. What we've just given out is a guideline that all persons must do. We're not about to build isolation centers. Isolation centers are in the domain of these experts. How can you start bringing us into that? The third question is your question as to the protocol for students in final year tertiary institutions. As you may well know, the federal government suspended orientation at the moment at NYCs. And because all students are not in school at the moment, but all universities, and remember that these people are already workers. The lecturers are working. They are not asleep. So they are interfacing with their students. And as soon as they reopen officially, some of them will be exiting. Some of them are continuously doing their, if you're in your final year, this will be a period to finish your thesis. Try to stay in touch with your lecturer. Just when you all were in university in Nigeria, this is almost, your final year is almost a non-exam year. You're almost working on your practicals, theories, all kinds of gathering your papers and your final dissertations. So I'm sure, and I can almost, my daughter is a final year law student, so I know she's already, her lecturers is a public university, so all of them are still working. All of them are doing that. So all of us must stay engaged, and this is the process that will drive it. I don't think anybody, even our students are not at home sleeping. I think they all are working, and I urge them to continue to stay alive. Thank you very much.
Ministers, members of the PTF, COVID-19, gentlemen of the press. The first question was whether I had any news about the ventilators promised Nigeria. I have no development. When I do have, I will let you know. Second question has to do with stigmatization, which I think has been addressed largely by the national coordinator. Yes, a long time ago we saw the need to mount a vigorous national campaign on stigmatization, which we have done. It's running on various television stations, it's running on the social media, and it's not just in English and Pidgin, but also in Hausa, in Igbo, and in Yoruba. We will continue to intensify our campaigns, but we saw this a long time ago, and we were quite proactive. The third question has to do with fake news. I was asked what the Ministry of Information and Culture is doing about fake news. I must tell you that I'm quite surprised at the question, because if by now anybody is still, especially the media, is still asking me what the government is doing about fake news, then we are indeed in trouble. This is because as far back as 2017, I dedicated an entire National Council on Information meeting to fake news in just Plateau State. After which I launched a national campaign against fake news in July 2018. Of course, that includes massive advocacy campaigns that took me and my team to newspaper houses, television stations, and radio stations across the country. When we announced a plan to set up a committee to deliberate on how to tackle fake news, regrettably, even the Nigerian Guild of Editors refused to send a representative. Journalists have a huge responsibility to tackle fake news more than any other group. This is because fake news hurts journalists more than anyone. After all, if the media loses credibility, because of fake news, then media practitioners will bear the brunt. If people stop believing in the media because of fake news, people will simply turn away from them. Therefore, I will throw the question back to you. What are you doing, you journalists, to tackle the menace of fake news? Because it's about your livelihood. It's about your credibility. Short of sensitization, advocacy, which the federal government has been doing, then what else can we do? We said it several times. We are not going to legislate against fake news. We are not going to use coercion. But we depend on advocacy, we depend on sensitization. But unfortunately, clearly it is not working. So let's try asking you, the journalists, to take responsibility by coming together to tackle the menace of fake news. There's the NUJ, there's the Guild of Editors, there's the Newspapers Proprietary Association of Nigeria, and there's the Broadcasting Organizations of Nigeria. Let all these bodies come together and join hands with us to tackle the issue of fake news. On our part, we'll continue to evolve ways to tackle this cankerworm. Fake news is a clear and present danger to all of us. We must all be concerned enough to take action against it. Thank you.
Let me see if I can tie these two issues together. I think it was Liberty that asked about the figures going up, and we're relaxing on the lockdown protocols, and the one by the Daily Trust, where he asked for how we all feel with the total disregard to the protocols put in place, and considering all the efforts, the sleepless nights, the long drawn meetings, and all the efforts that are being put in place. He did ask how we felt, that everybody dodged the question nobody wanted to answer about how we felt. Sometimes some sense of frustration, because you can see glaring the dangers ahead. And you can also see the level of complacency, sometimes gravitating towards recklessness on the part of people who should know better. The numbers are rising, and they will continue to rise. The only thing that can abate these numbers or reduce the numbers growing in their numbers, or the exponential growth in the number, is when we are comply with the protocols that have been set in place. That's the only thing. And it has come to a critical moment when I believe, as a people, as a country, that we have to take certain drastic decisions to deal with this pandemic. I think we have become too casual with it. I was just flipping through my phone and I saw a graphic picture, or I don't know whether it is Tom or Jerry, of when we were confronted with this pandemic in the month of February was our first index case, but it became obvious that there was growing spread. And the graphic picture of Tom or Jerry was fear. Not as much, but by the time we got to June, fear had disappeared. As a matter of fact, he was romancing the gun, which was the vivid picture of COVID-19. He was already romancing it. He was bringing his head to be touched by the gun. And that's exactly the picture we have in this country, and globally too. So it's a very, very serious issue. And what Dr. Brian Kalinawaga, the Filipino doctor, said drives home the point. I have quoted this. It drives home the point that the federal government, with the support of our development partners, can invest as much money as we can, in spite of the limited resources available, build molecular laboratories all over the country, buy all the PPEs, get all the reagents for testing, equip all the hospitals, pay the health workers all the hazard allowances. As long as there is no cure, either by way of vaccine or any form of medicine, the only way we can stop these numbers from growing exponentially as it is happening now is by obeying and complying with the non-pharmaceutical interventions that have been put in place. And that was why he said, we the health workers are no longer your frontliners anymore. We are your last line of defense. Because a fully kitted medical officer or worker cannot stop you from contacting or being infected with COVID-19. In spite of his kitting, he can't stop you. There's no way he can stop you from getting infected. He can be walking around with 5 different reagents in his pockets. That wouldn't stop you from getting infected. Like Dr. Sani said, nobody leaves his house with the desire to get infected. But if you are careless about it, or you do not take the necessary precautions and do not comply with the basic non-pharmaceutical interventions that have been put in place, you stand the risk of getting infected. You stand the risk. And like he further went further to say, he said the war has shifted to the community. So it means that all our health workers gathered together. They can't stop because the war has shifted to the community, because we are at the level of community transmission. So what we do in the communities and how we act would determine whether we will be able to drastically reduce the rate of infection. He said the battle cannot be worn in the confines of the hospital. And that's basically what I was trying to drive home. It's not the isolation centers. It's not the beauty of the hospitals. It's not how equipped the hospitals are that will be able to flatten the curve so that we can progressively begin to deal with the infection in the community. But our attitude, our behaviors, and response to the non-pharmaceutical interventions is what will take us through. And that ties to the issue that Amaka raised about, don't we think it's high time to criminalize breaches, especially large gatherings? Well, Dr. Bryan also spoke about it. He said gatherings are still not okay. Any form of gatherings are still not okay. Yes, I know it's an electioneering period for some states in Nigeria. People will need to congregate, but we must begin to devise other means, or else the people that are aspiring to lead these offices would end up, by the time they become governors, their entire budget resources in their states would have to be used to deal with the problems that they would have created. So it's a very serious thing. I'm a politician. I've been in this business for almost 40 years. But I can assure you that there will be nothing that will take me to any political rally now. Nothing. I will use other mechanisms of reaching the electorate. But to congregate in a political rally, for what? For what? So we have to be very careful. The choice is ours, individually, that we must make. Nobody can make that choice for you. The truth about it is that efforts, skepticism, and disregard would not take us anywhere. It's not in my tradition when I'm sitting there to answer any phone call. But I was forced to do one this afternoon. And I'm driving home a point. For those that do not believe that COVID-19 is real, because I saw a persistence in the call coming from a particular person, and I picked it just to confirm the death of somebody as a result of COVID-19. So this is what people like you and I deal with on a daily basis. Those are the kind of information that we keep receiving. And that was why I said, oh, sometimes, not all times, I know the enormity of the responsibility that all of us in the committee bear, the burden we carry on a daily basis. So in spite of the entire summation of the attitude of Nigerians towards this response, I wake up every day feeling stronger, feeling resolute, feeling determined to keep pushing this agenda. Because that is the only way we can stop a calamity befalling our nation. We are not better than other nations that have come under intense fatalities. We always refer to Brazil because we share a lot with Brazil in terms of culture, in terms of demography, in terms of climatic conditions. Their test values have exceeded 1 million. Their fatalities, after the United States, is second, over 50,000, and it's growing in number. And Dr. Sani said something that probably needs some bit of clarity. And I will be bold to say it, that if we test as much as we get the samples, the number of infections today will not be 22,000. Get that straight. And that's what he was saying when he said that in every one confirmed test, we would have missed out on about 4, 5, 6, 7. So that's the Herculean number you are dealing with. So the message is very, very simple, that it is not time. You want to hear the truth? If it were within my powers, this is the time to lock down. If it were within my powers, this is the time to lock down. Lockdown might not be a popular thing, but this is the time to lock down. Because I can see the attitude of Tom and Jerry. We are already romancing with COVID-19. And it's not good. So the message out there is that we continue to take personal responsibility. We continue to do everything within our powers to ensure that we reduce the level of the transmission in the community. And unless and until a vaccine comes on scene or any form of medicament is available for treatment, not this trial and error that we are doing. Because right now it's trial and error. Nobody can say. That's why every time you ask the question, what is the protocol of treatment in Nigeria, we are unable to give you the answers. Because every doctor that is treating a patient would evaluate the patient based on the symptoms he exhibits and make the appropriate prescriptions. So what you would take, like Dr. Sani will always say that you can eat kola nuts and get cured and walk out of an isolation center. Some others that are very unfortunate will have to end up on ventilators and eventually become fatalities. That is the nature. Somebody was sharing with us today at our meeting that a woman yesterday gave birth to, is it twins or triplets? The father and the mother don't have COVID, but the twins ended up with COVID. How did they get the COVID? Triplets. How did they end up getting the COVID? So it's a novel virus. Nobody can predict it. The only prediction is to make sure that you comply with the non-pharmaceutical interventions that have been put in place. Wear a mask in public places, maintain personal hygiene by washing your hands or using sanitizers, stay out of crowded environments. If you have no business to go anywhere, stay at home. Maintain social distancing. I saw a depiction of real romance today. Real romance with COVID-19. People behaving as if the matter is over. It's a very serious issue. And my appeal to Nigerians listening, let's take this thing serious. By now, with 500 plus fatalities, you can't be ignorant and you can't say you don't know of anybody that has fallen victim, either by way of name. You might not have met them in person, but you have seen their pictures and you have seen them on the glares of television on a daily basis in the past. But today, they are no more. I want us, in the same Nigerian spirit, the intensity with which we pursue our lives, let's apply it. Preservation of our lives. Thank you and good evening.
Thank you very much, Chairman, Presidential Task Force on COVID-19. That intervention by the Chairman brings us to the end of the national briefing for today. Before we go, Let me remind you, especially our colleagues from the press, that the trip to Lagos is Saturday. If you wish to be on the team, we have limited number of seats, and the early birds will be accommodated. So put down your name and your organization with Mr. Bassi, the Director of Press, so that you can be considered and you'll be informed about the details. There's a lot of very strong messages have come out of today's briefing. If you're watching us from home, in case you missed any part of it, let me quickly bring back to you some of the messages that have come out of today's briefing. COVID-19 is still the most important public health emergency of our time. And given the numbers that are coming out, both at home and from other jurisdictions, there is glaring danger ahead of us. As we continue to discover more details about COVID-19, we have also been informed this evening that if you feel any sense of loss of smell or taste, it could be part of this. It is now part of the symptoms recognized for COVID-19. You should please go and seek help. Also, protecting yourself is important. We urge you to wear your mask. It will not make you feel weak. Neither will it make you look scared or controlled by government. It only makes you a considerate person. You must, however, wear it properly. It is about self-preservation and protection of your loved ones, the old and the vulnerable. Finally, do not stigmatize anyone infected or anyone who has been treated for COVID-19. COVID-19 is not a scam. It is very real. Avoid catching it at all costs. Keep safe. Take responsibility. God bless Nigeria. We hope to see you on Monday. Thank you very much.